Our hospitals and our local healthcare staff feeling the strain as the number of hospitalized COVID-19 patients continue to rise day by day in this latest surge. In today's KSAT Q&A, we're joined by Dr. Robert A. Frolichstein, emergency room physician at Methodist Hospital. Doctor, thanks for sharing some time with us here today. Let's just talk about where we are now. We talked to you in the last surge during the fall and the winter. So describe what you're seeing in the ER right now.
So thanks for having me on and giving me this opportunity. You know, I think the numbers are probably not as high as they were at the peak of the last surge, but we're also not at the peak of this surge. So who knows where it's going to go. But it does. I mean, they're definitely, COVID is back. We're seeing lots of patients with COVID. Probably a little bit younger population is getting COVID. I would say it's about the same as far as who needs to be admitted versus who can go home. But people are sick, and, you know, there's a lot of people coming in and they've never been this sick in their life. But, you know, thankfully their oxygenation is good and they don't have to be admitted to the hospital, but they feel terrible.
Can you put a percentage on it, on the number of patients you've seen that have had to be hospitalized when it comes to whether they were vaccinated or not?
I personally have only admitted one patient that is vaccinated for COVID-19. I would say, talking to all my colleagues and my colleagues in the intensive care unit, more than 95% are unvaccinated.
Can you talk a little bit about the symptoms that people are experiencing? I mean, saying that, you know, they've never felt this sick in their life. Are things any different with the Delta variant compared to what we saw in the fall and winter?
Not really as far as the type of symptoms. I think it's just the severity. And you know, it's a virus, and all viruses cause this, we call it malaise, where you just feel lousy and you have body aches and, of course, fever, a lot of nasal congestion, cough, shortness of breath. And those symptoms are the same as the prior surges. It just seems to be a little more severe.
Talk to me about the personal face of this for you and other healthcare workers in town. I mean, you and I joked with each other that we enjoy talking to each other, but we hope we never have to talk to each other again. And this whole thing, you know, maybe over a beer, but not certainly over Zoom talking about the next surge. Right. What does this mean for you and your colleagues? I mean, they're talking about nursing staff that's burnt out, that just isn't coming back. I mean, there's a lot of people that are stressed and fatigued. I mean, what does this mean for you and your colleagues?
Yeah, you know, this one seems harder. And I think there's a couple reasons. One is that, you know, the prior surges, a lot of the people that needed to come to the hospital for other things like appendicitis didn't come. And I'm glad they're still coming, and they are still coming. And so that does make it harder on us, though. But I think by far the biggest thing that makes this hard is it seems like it all should be preventable. This shouldn't have happened. And if, you know, a bigger percentage of the population was vaccinated, this would not have happened.
Preventable if vaccinated. So you said that we're not at the peak of this surge. So going forward, as we see these numbers continue to rise, which is certainly expected, how do you think that Methodist Hospital, our local healthcare system, is going to fare when we're talking about a much different scenario than when people, as you mentioned, weren't coming to the hospital for other routine things?
Yeah, so you know, one good thing about this is we've gone through this a few times before, and we're pretty good at making space, making places for people to be seen and treated. So I think we're going to do okay as far as capacity. It's if we can keep our staff healthy and if we can keep them burned out, then I think we'll do okay as far as that goes. You know, we have not yet cut back on any elective cases or elective procedures or anything like that. And you know, I think the hope is that we don't have to do that. But certainly that's one of the strategies when you start running out of beds. That's certainly one of the strategies that you have to consider. I hope we don't ever get there.
You know, you and I have done, and Myra's done this interview numerous times, and I always like to give you the last word, the last message to our viewers out there. You have a platform here, Doctor. What would you say to the viewers who are out there?
COVID's back. By far and away, the most effective tool you have to prevent getting it or giving it to others is to get vaccinated. All the other stuff like social distancing and masking helps also, but by far and away, our strongest tool is vaccination. So, and it's not too late. Go get it right now. There's places all over the city. It's free. It's easy. Go get vaccinated. I've not seen a single complication of vaccine in my 18 months of doing, or however long the vaccine's been around, 9 months. I've not seen one case of someone coming in because of the vaccine caused a problem.
And the vaccine, a critical tool in keeping patients from seeing you, keeping you out of the hospital.
Right. And it doesn't mean you won't get it. Just like the flu, people that get the flu vaccine sometimes will get the flu, but typically the ones that we've seen that have had the vaccine, it's much less severe, and it's just going to dramatically decrease your chances of getting COVID or spreading COVID.
Dr. Robert Frolichstein, I can't promise that we're not going to have this discussion again in the coming weeks, but I always appreciate your time.
All right. Thanks, Myra. Thanks, Steve.
Thank you. We'll be right back.